So your shared accommodation facility, and you should be checking regularly and just keeping an eye that people that are living there and staff are well. So what happens if someone says to you that they feel unwell and the symptoms that they report are suggestive of COVID? So the first thing that you would need to do would be to isolate that person. So find somewhere where they're not in contact with anybody else and they're able to be without wandering around and coming into close contact with anyone else, unless that other person has got PPE on. So some of your staff, if it's somebody in your facility and it's a staff member and they have to work with them more closely, at that time they will need to wear PPE. So and then that will be safe to work with someone. But the first thing that we need to do is to organise for that person to be tested. So Healthline or call their GP and they will organise a COVID test. Then within your shared facility, if you can safely isolate that person and keep them away from others, then you can keep that person there. And it may include, them staying in their room. If you've got a bathroom that can be solely used by them, and also encourage them to either have food brought to their door and have food in their room or somewhere privately away from others so they're not in contact with other people. The other thing that you'll probably need to do is to clean. You'll be cleaning regularly anyway, but it might be good just to go through and do an extra clean and to follow all your health and safety protocols around and that cleaning. And then you'll wait for 24 hours, 48 hours for the test result to come back. And then we suggest that you talk either with your public health, local public health unit, or go with the protocols that you already have in place for keeping all of the safety stuff, so regular hand washing, regular cleaning, people keeping separate and to themselves and isolated for the period of time they're unwell. And if that's a family, that actually may be the whole family, staying away from others and having that. So once someone has been identified as having COVID, then you will need to share all your contact tracing logs as well with the public health department. And also you will need to let anybody know, like staff or visitors or anyone like that, to know. You have to let them know that you are in the process of contact tracing and follow-ups, and that the likelihood is that they will be contacted by telephone. The other thing is you may be advised that any staff or any other people that have been in close contact with that person who's become unwell, if it's a staff member or if it's a visitor or if it's someone living in residence, they will have to also isolate. So get some guidance on public health. So one of the ideas that we've suggested to prevent all of your staff becoming unwell and having to isolate at once is to create smaller teams within your workplace. And that reduces the chance that that could happen. So that's why we do that. And there is information on the CHAO website which will tell you more about your local public health unit telephone numbers and the follow-ups and the cleaning routines and all of the things that you'll need to know about managing someone in isolation within your shared facility. If, though, you feel that it's not possible to safely isolate someone within your shared housing facility, or you feel that you need more help to do that, you can get guidance and assistance from the public health unit, particularly if you have older people, you're caring for older people and older people living in your house, or you have people who are particularly vulnerable to more serious complications of COVID, then you can get more advice and support about that. And it may be that people need to move out of the shared accommodation temporarily into accommodation where they can isolate safely and recover. And then once we're, you're sure, and the health department are sure that people are well, they can move back into the facility safely. So you can get some guidance and support on that.